In my early training, I spent time with a doctor down in Peru, and he was so hyper-focused on nutrition. His training was actually as a surgeon, and he came and studied in the States, and he said, I just kept removing tumors out of these obese patients. I'd see him back on the exam table like 2 years later, and he's like, there's gotta be a better way to address the root cause of this. And so he dove heavily into nutrition, talked to people about what are they eating, what's their stress levels like, are they sleeping, and then what are their environmental influences. He went through all the detail, and he impressed upon me this saying. He said, let food be your medicine and medicine be your food.
Oftentimes when someone is diagnosed with cancer, they feel as though it is a death sentence, and it's not. It can be a very scary word and diagnosis, and people can oftentimes just feel completely overwhelmed and not know where to go. So here at Whole Family, we are able to help guide you on that journey and to be able to lay all of your options on the table and be able to give you education on what your best option may be. And we work closely with you and your oncologist to be able to give you the best possible healing.
Our cancer support program provides adjunctive therapy to those going through conventional cancer treatment. Why that's important is because when going through conventional cancer treatment, some of the most common complaints and side effects are neuropathy, fatigue, poor digestion, mental health just kind of takes a dip. And so where we come in is we really help support the moods with nutrition, their energy levels, and then we can do unique therapies, some of the nutrients and acupuncture for things like neuropathy, which are pretty common side effects with most conventional therapies.
During a patient's first visit, we'll sit down and go to a deep history when it comes to family history, your own personal history, whether it's symptoms, just how you've been feeling overall. Cancers can be less than 3% are actually genetic. So there's other things such as epigenetics that could be causing your cancer to surface, and we want to do a deep dive during that first visit to be able to figure out what in your environment might be causing a lot of this havoc on your body. Whether you've just recently been diagnosed or this is something you've had for a while and you've just become frustrated with how your cancer journey has come along, or maybe you're somebody who is in remission currently and you have that little fear that keeps popping up as to if or when this might return. We are here to be able to guide you on that journey and be able to give you that foundation you need with your body when it comes to nutrition, when it comes to your health, when it comes to emotional and spiritual support to be able to help keep this cancer away.
After they're done with their treatment, you gotta boost them up, and you gotta teach them the right way to live so they're not living in fear, and they can figure out a way to feel really good. And a lot of our patients actually feel better than they did before they even had their cancer diagnosis.